Understanding your BRCA1 and BRCA2 risk. What you need to know. Hello, I'm Dr. Gatas. Today, we're going to discuss a crucial topic that many of you might have heard of but perhaps don't fully understand. BRCA1 and BRCA2 gene mutations and their association with breast and ovarian cancer. Did you know that approximately 1 in every 500 women in the US carries the BRCA1 or BRCA2 mutation? BRCA, which stands for breast cancer, has the potential to significantly impact their lives. Without proper treatment, these women face a 7-fold increased risk of developing breast cancer and an astonishing 30 times higher risk of ovarian cancer before the age of 70. Ashkenazi Jewish women are 10 times more likely to carry a BRCA1 or BRCA2 mutation compared to the general population. Let's talk about what BRCA1 and BRCA2 are. These are genes that everyone has. They play a vital role in our bodies by producing proteins that help repair damaged DNA. This repair process ensures the stability of the cell's genetic material, and when functioning correctly, these genes can help prevent the development of cancer. However, when there's a mutation or alteration in either the BRCA1 or BRCA2 genes, these proteins either aren't produced correctly or don't work as they should. This can result in DNA damage not being repaired properly, which may lead to cells growing and dividing uncontrollably, forming a tumor. BRCA testing assesses the likelihood of genetic mutations that increase the risk of breast and ovarian cancer. These mutations can be identified by meeting specific guidelines based on various factors. While national guidelines serve as a reference, expert counseling is crucial to evaluate your eligibility and interest in testing. Some common qualifying features include breast cancer diagnosis before the age of 50, ovarian cancer history, family members carrying the BRCA mutation, and strong family history of breast, ovarian, prostate, or pancreatic cancer. Other factors like previous bilateral breast cancer, male breast cancer, triple-negative breast cancer under 60, or Ashkenazi Jewish heritage with family history also increase eligibility. Trust your breast cancer specialist or certified genetic counselor to gather this information, discuss the pros and cons of genetic testing, and help you make an informed decision. Now, let's talk about prevention of developing cancers with these genes. Let's move on to prevention strategies. If you carry these mutations, there are ways to manage your risk. These include enhanced surveillance. This involves more frequent and intensive screening tests, such as mammograms and MRIs, from a younger age than typically recommended. For ovarian cancer, this could include regular pelvic exams, transvaginal ultrasounds, and CA-125 blood tests. Risk-reducing surgery. Prophylactic or risk-reducing surgery such as bilateral mastectomy, removal of both breasts, and salpingo-oophorectomy, removal of ovaries and fallopian tubes, can significantly reduce the risk, but come with their own potential side effects and psychological impact. Lifestyle modifications. While no specific lifestyle changes have been proven to reduce the risk of cancer in BRCA mutation carriers, general healthy lifestyle recommendations like maintaining a healthy weight, regular exercise, a balanced diet, and limiting alcohol consumption can contribute to overall health. Remember, the best prevention strategy for you will depend on your personal circumstances, including your age, overall health, and family history. Always consult with your healthcare provider to make an informed decision. Genetic testing is a powerful tool, but it comes with its own set of considerations. Emotional impact. Positive results may stir up anxiety, depression, or fear. Seek support and professional help if needed. Potential for false positives or negatives. No test is perfect. There can be false positives, which might lead to unnecessary worry or preventative measures. There can also be false negatives, giving a false sense of security. Uncertain results. Sometimes, genetic testing reveals a variant of uncertain significance, VUS. This means the implications of this particular gene variant are not yet known, which can be frustrating and confusing. Privacy and discrimination concerns. Laws protect against genetic discrimination, but privacy worries persist. It could affect employment or life insurance. In recent years, our understanding of the genes associated with an increased risk of breast and ovarian cancer has expanded beyond BRCA1 and BRCA2. Enter multi-gene panel testing, a remarkable advancement that examines multiple genes in one go, offering a comprehensive view of a person's genetic risk. Let's talk about the exciting benefits of this approach. Not only does it provide us with a wealth of information, but it also has the potential to uncover risks associated with other types of cancer. However, it's important to acknowledge that more information can bring complexity into the picture. For example, multi-gene panel testing may reveal variants of uncertain significance in other genes, which can understandably lead to feelings of uncertainty and stress. As with single-gene testing, it's important to discuss the potential benefits, limitations, and implications of multi-gene panel testing with your healthcare provider to determine the best appropriate approach for you. The genetic landscape of cancer is complex, and it's our job as your healthcare providers to help navigate it. Multi-gene panel testing is one tool in our arsenal, but it's important to understand its benefits and limitations. To wrap up, if you're concerned about BRCA1 or BRCA2 mutations, here are 3 questions you might consider asking your oncologist. Based on my personal and family history of cancer, should I consider genetic testing? If I test positive for a BRCA mutation, what preventative measures would you recommend? What are the potential emotional and physical impacts of knowing my BRCA status and the associated risk management strategies? Transforming battles into victories. One patient at a time. Tharwat Gattas, MD.